Sometimes you see a kid and out of nowhere, there seem to be white areas of the skin, and the parents are worried the kid's going to lose all the pigment. What is that all about?
We're talking about vitiligo. Rarely affects in a family, once in a while. However, it's an autoimmune disease, which is a fancy word meaning for who the hell knows what causes it, because it's like juvenile rheumatoid arthritis, lupus, any of these things. Now, it's mild, it's cosmetic. However, it depends what ethnicity you are. So if you're Indian, Pakistani, black, it's a whole other issue. In other words, because now that makes a big deal. And it makes a big deal for other reasons. If you're coming from Asia, it doesn't look that much different to an uninitiated person than leprosy. Okay.
Is there any treatments you can do that are successful?
Yeah, the original treatment was Pruva, but I think that's fallen out of favor because it's a systemic drug and there's a whole slew of problems with it. Number one, it's a drug. You got to take it by mouth. You have to protect the eyes for 24 hours afterwards because it stays in the system for 24 hours. It increases your chances of skin cancer, at least in psoriatics. And you're looking at twice a week for a year, 100 treatments. So down from that now is narrowband UVB, which is an ultraviolet, no drug. And it works almost as well, but it still takes a lot of treatments. And the last thing, which works better than narrowband UVB, but you can't do a whole body, is laser. So it's called an excimer laser. It's in the same wavelength. It's 308, so it's an ultraviolet, but they took the peak and concentrated the light into a fiber, so you've taken the power of all these sun lamps and come out with a spot, so now you've juiced it up. And that works in as little as 15 visits. The best places are face, neck, chest is okay, back. Really, really tough areas are fingers and toes.
Do they always have to be treated, or it gets better by itself?
It might get better by itself, but I can't tell that because I don't see people get better on themselves. And some people, it just keeps going.
Is there any diseases that can present like this?
You're supposed to check for autoimmune diseases, so you're supposed to check for thyroid problems, because there's a slight incidence of it. I've never seen a case of lupus that crosses it, but basically you're looking for thyroid. In the old days, probably 40 years ago, you're supposed to look for pernicious anemia with it, because that was an autoimmune disease in the old days. So you're supposed to look for that. It's a question of how cosmetically disfiguring it is. So obviously, black person face, it's cosmetically disfiguring. So it would be nice to treat them earlier if it's going to psychologically bother them. You don't want them to get to where they're missing 40–50% of the color. You're lost. It's, when you're missing more color than you have, you're never getting that color back. You have to stimulate the cells that are still there to grow back. So when you get to when the glass is more than starting to approach half empty, the game's over. You're not going to get color.
Merit to giving steroids to these people?
Systemically, I wouldn't trade it off because you're not getting off of it too fast. Topically, I don't think it does much. Protopic, which is a calcineurin inhibitor, which is a non-steroid, does something by itself. Vitamins work in South America very well, except they don't work as well here. So the South Americans use mega doses of vitamins and they've gotten some improvement. And before the laser came along, I used to use mega doses of vitamins.
Basically laser that you're doing now?
Laser plus the vitamins.
I thank you very much.